Hi, everyone. Welcome. Welcome to the episode tonight. So happy to be here with all of you. I'm just clicking over here to Facebook to make sure that we are live because I see the broadcasting sign and it always makes me feel more comfortable to know that I can see all of you. But I am here and it is Tuesday night. It's been quite a while since I've been on with you. I've been away, as most of you know, for the past week. And so I'm just really happy to be back and doing such a special episode tonight. A couple years ago, I did this same episode. It's already about 5 years ago, and it was so important, and it was so helpful to so many moms. And it's been several years that I've been looking forward to recreating that again, to have this discussion on miscarriage and infant loss with all of you. And not an easy topic. Some of the shows that we do are very easy to do. Others are more difficult, but nonetheless, super important and something that touches so many different lives and many of you, as I already know. And so when Alison's here with us, said to me, let's do this show. I said, this is what I've been waiting on with us. She's sitting here and I'm gonna actually put us side by side. Now that I see us, Alison, I want you right there with me. So there you go. So this is Alison Jacobson, and she is the CEO of CJ First Candle, and she's become a very good friend of mine. Welcome to the show, Alison. I'm so happy to have you.
Oh, Shari, thank you so much for having me. And I'm so happy that we are talking about this topic that affects so many women and families, parents.
So many. Like I was saying, we did this a couple years ago, and it was like back then, it's not a topic that's discussed very often. It's not your typical live stream that most people do on Facebook, but from the response that we have, you could see even right tonight, like just how many moms and dads, how many families really need to hear more about it. And I'm just grateful you're here with your experience and and even our own personal experiences. So I just wanted to ask you if you could just give your background a little and explain what CJ First Candle is, because they see that on the screen here, and I want them to know. And everybody here in the audience too, I just wanted to say hi. They're all logging on here, and I see all their faces, and thanks for coming, guys.
Yeah, and thank you. I'm watching all the comments too, and a special hi to Luann, a dear, dear friend of ours. And actually, her company is one of the sponsors tonight, so thank you.
Yeah.
So I've unfortunately, my position as CEO of CJ First Candle arose out of tragedy. My first son, Connor, died of sudden infant death syndrome in 1997. He actually would have been 20 this month, which is hard for me to believe. It was shocking. He was 3 months and 24 days. And aside from that, I also had 2 miscarriages, one which was a partial molar pregnancy. So I've been through a lot. And I was part of First Candle years ago when Connor first died, and then went on to have other kids, and life kind of took a couple different turns and twists for me. And now I am back, and it feels like my life has come full circle. I feel like this is kind of where I was always meant to be. And I always tell people, because they say, how did you survive such a tragedy? But as much as I would always want Connor back, I feel like his little spirit and his guiding light has put me exactly where I'm meant to be.
Yeah, absolutely. Isn't that the case? And it's like sometimes the most difficult experiences of our lives shape our lives. Well, they usually do. And then just how amazing it is that you've gone on to help so many more people with your tragedy, and your loss has affected so many other lives that needed you so much. So it's a great honor to him. And wow, 20, I'm sure it's hard to think about, like, wow, that he would have been that old at this point.
Yeah, and you know what? I have to say that last year was the gala for First Candle, and as I stood up there, it was very emotional for me. I mean, never did I think, I talked to so many couples and moms and grandparents, and that that's the hardest part of my job, but it's also the part I love, because we are all, everyone probably on this call and this live stream is part of a club we never wanted to be a part of. And that is what's so great about social media. This is a safe place where we can come and grieve and be understood like nowhere else.
Yeah, absolutely. It's one of the best things. There's so many different things about social media, some things that are good, some things that are not so great. But when it comes to these type of live streams, these conversations, and like you said, all these people being able to come together to talk about, a topic such as this or any of the ones that we do, we're not alone. We're not alone. And even for me, I'll give a little bit of my experience too, but I just I see Elizabeth there and I see Kelly. And like you said, Luann, we have some amazing sponsors tonight who really supported this program to happen. And that's from Love to Dream and also from Lalaboo. And so I just wanted to send some love to them because, that's the reason that we're able to continue to do these topics. And if everybody could just give some hearts and say hello to them. They're just amazing people as well. So they're here in the chat room with us. Thank you guys. But even personally, Joe and I have been touched by this as well. About 7 years ago, we lost twins. We were pregnant with twins, and we had always wanted more children after the girls. And so when we found out that we were pregnant, we were super excited about that. And it just at around 12 weeks, I lost them. And it's something that, as a midwife, I had spent so many years taking care of new parents through their losses, through their pregnancies, losses that occurred during labor, losses that occurred afterwards. And yet when you experience it yourself, there's a whole other side to the grief and to the understanding on a very visceral level. It's not just, you get it in your mind, but when you get it in your heart in a personal way, it's something that really sticks with you in a very different way. And I know it's changed for me, my perspective, of taking care of parents and understanding what that's like.
Well, and I think one of the greatest gifts or changes that came about for me is I became so much more empathetic. I'll never forget going back to work after Connor died. And I live in Connecticut and I worked in Manhattan, and I took the train in every day. And I remember sitting on that train and looking at everybody saying, everybody here has a story, and we may not see it, but everybody is grieving in some way or another. And, it made me stop and look at everybody and really try to send love.
Yeah, absolutely. Absolutely. And that it just doesn't really go away. It just really, it's there with you. And you're right. Like everybody has their story. Everybody has something that whatever it is, or it could be, a family member. My sister also lost a baby, at 26 weeks, a year after I had my miscarriage. And that was a whole other situation of going through that with her. And, I just really, I think about that today, just what a difficult experience that was, and how there's still so much sadness around the loss of what would have been.
Well, it's interesting that you say that, because I think that when you look at how moms and dads grieve, it kind of comes down to that. And there's been a lot of studies around that, where moms grieve more about what had been and the memories, and dads are really about what would have been. I would have seen him playing Little League, or I would have seen her at her first ballet recital. So it's interesting looking at it from those two perspectives. Totally.
I think I want to just talk a little bit about the prevalence. As you said, everybody's got a story. And when it comes to miscarriage, when it comes to loss, whether it's stillborn or infant death and SIDS, there are statistics. And I want to tell you a little bit about as far as the miscarriages. And I can say this from just my practice of how many miscarriages I did see in my practice, because it is pretty common. It's actually very common, more than most people think and know until they're actually going through it themselves. And then they look into it and they realize, wow, this is a pretty common thing. 75% of pregnancies will end in a miscarriage or will actually not go to full term. And what that means is that many of them will happen before you even know that you're pregnant. There's just no implantation of the conceived fetus. And so you just get a period and you don't realize that you had actually conceived. And 75% of pregnancies will end that way. And then once you do miss a period, it's like 1 in 3, which is surprising to a lot of people, that 1 in 3, will not go on. And I always said, every time I delivered a baby, it was so rare. And I did this for, I delivered babies, whether it was as a labor and delivery nurse or a midwife, for almost 15 years. So I was around a lot of births, thousands of them. And it was so rare to see a baby with any kind of a problem at birth, to the point where we were surprised when we saw something. And if you think about all the, things that could go wrong, then you realize why that number is so high. That, right. It does end before it actually starts. And so there's the percentages are pretty high, and most of them, thank God, will happen in the first trimester. So, right. You're obviously not alone.
No, and I think that's one of the challenges between miscarriage and stillbirth is people don't talk about it. People don't know how to talk about it. So they don't realize how high a prevalency it is. And when we talk about stillbirth, and just so people know, stillbirth is after 22 weeks. There are 24,000 stillbirths every year in this country. And then still after delivery, there is 1,500. SIDS is still the leading cause of death for babies 1 month to 1 year of age. And then there is also SUID, which is sudden unexpected infant death. And that is the accidental suffocations or other things. That's another 2,500. So when you take all of them together, that's 3,000 a month that we are losing from stillbirth, SIDS, or SUID. It's pretty remarkable.
Yeah, absolutely. And that's where, First Candle has done such amazing work. Working with parents in education, in, just giving the right information to help with that, and also with the grieving process. And I think that's what we're going to talk about more tonight is, when you've gone through a situation like this, what is the process of the grief? And if you know someone who did, how do you support them? What's the best way to support yourself or to support a loved one if they're going through this?
Right. And I think that everybody grieves differently. That's one of the challenges. We're all different. And it depends also how we come into that. I mean, if there were problems in your marriage to begin with, that's going to impact. If you had problems with, your family or your siblings, that's going to impact things. So I think it depends where it is. But as a society in the United States, our whole thing is, buck up and let's just, keep going. And that's not grief. Grief isn't this linear process, right? It's two steps forward and 1 step back.
Right.
And we have to be okay with that. And we have to understand that's okay. There is no rule book for grieving.
Yeah. And everyone does it differently. And it's such an important part to keep in mind, because I think that, people can also wonder why you may not be getting over something, or wondering why it's taking, you're handling it differently than somebody else would. And it's a very important part that you just mentioned, which is there's no rule book and there's no timeline. And there's so many people who experience it differently. And to give people space to have the time that they need and to do it in their own way.
Right. And again, getting back to that point of husbands and wives, it's also very hard when you're connected and grieving differently. I mean, I remember when Connor died, my husband at the time, he just took up running. I mean, literally, he was just constantly running. And I don't know if it was running away, but it was letting it out. And for me, it was much more of a kind of nurturing. And I just wanted to curl up in bed. I wanted to be cozy. So honoring also the way we grieve within the family is challenging.
Yeah. Did you have other children at the time, Alison? Was he your first, or was he?
Yeah, he was my first, and then I got pregnant with my second son, Spencer, very quickly. So I lost Connor in August, and I was pregnant by September.
Wow.
So, and for some people it's right, for some people it's not. For me, it was the right decision, but I can tell you that first, and I try to tell parents this all the time, the first year, you've got to get through all of those firsts because
Yeah.
it's really hard.
Yeah.
And you've got to allow yourself that time. And I was on the phone with a woman. I take as many calls as I can at CJ First Candle. And I was talking to this one woman who was asking me, how do you get to 20 years? And does it get better? And I'm here to say you do survive, and it does. It's not that it gets better, it just gets different. You're never going to forget, and it will fundamentally change you. But it also depends how you choose to work to get better and to heal and to find comfort.
Yeah. Yeah. And I'm sure you need a lot of support to do that, and also to keep on moving forward with your life, and knowing that it's okay to keep thinking about it and not ever letting it go away. It's not going to. I agree with that. It doesn't ever go away, and it doesn't really get better. But it's just, like you said, different. I feel the same way about my loss as well. It's like there's times where it'll come up and I'll think about it, and it's right there, and I'm right back, and I feel it, and there's sadness, and then yet it's different than it was in the beginning.
Right. I kind of liken it to PMS, because when you get past, all of a sudden there'll be some time and you find yourself getting cranky or stressed or something, and then you'll come up short and say, oh, it's because I'm remembering this, or it's right around the holidays or something. And you don't realize it catches you by off guard, but it's always still there to some degree.
Yeah, absolutely. And it's the thing is, and I've heard so many parents talk about this, is that, that child, whether you carried the child full term, you delivered like you did with Connor, or with, like I didn't, but with the twins, they're still your child. They're your children. And, they existed. Everybody has their own beliefs about that, and feelings about that, but they are still a child. And, I think that it's important to acknowledge that, for people to be able to acknowledge that, and to have other people acknowledge it too. That there's, whether it's a miscarriage or not, it's a loss. And, a lot of people choose to maybe name the baby. That's actually something that, some people will choose to do and some will not choose to do, but it's very individual. And, go ahead.
Yeah, no, and it's a personal choice. And, getting back to those friends who are looking to support you, some of them may not understand. Some of them may not understand the choices you make. And I've done a lot of blogging about how to support friends when they've lost a baby, because they don't know what to say. And they may be very well-meaning, but say something without thinking, and it can destroy a friendship. So I also say to the grieving parent, go easy on them. They're doing the best they can, and they just don't know.
People love you and just want to support you, but they don't know how. And it's a hard thing for other people to know what the right things are to say, to not say, how to support, and all those things. We're going to go over that in a little while, because I think that could be really helpful for a lot of our viewers, whether, even if you've gone through this yourself, and I've seen this for myself too, to even say something like, I understand how you feel, in a way is a little bit arrogant to really understand how somebody feels. I know how I feel. It doesn't mean I actually know how you feel. And so it's just all of that is to really just be there. You don't have to say much, honestly. There's not much to say. There's not much to say.
So we do a lot of peer support training at CJ First Candle, and we don't let anybody do peer support training until they're at least a year to 2 years out, because they need to work through their own emotions. But that's one of the things we always tell them is just listen. Ask them, talk about the baby by name. Like you said, some people will name the baby, some people won't, but just ask, because people want to talk.
Yeah. I see somebody in the audience here saying, Jenny, she said she named her little one Asher, and a lot of people think it's illogical. And that's just exactly what we're saying here. It's what brought you comfort, Jenny. It's what you chose to do, and I'm sure that's what you feel good about. And everybody's different, and other people's opinions. Unfortunately, people like to give their opinions way too often about things. But it's a beautiful thing to be able to remember by and create keepsakes and create those memories. Forgetting is not possible for most. And so being able to remember and to keep that keep the love there is actually a comfort.
It is. And when, like, as you said, I said, I didn't have kids when Connor died, but they all know about their brother. So
Mm-hmm.
every year we have a Christmas stocking with Connor's name on it, and we all put something in. He gets a ornament on the Christmas tree every year. I told all the teachers when they went to school when they were young, if they said how many siblings, they would say 3, and they were accurate. So they know about Connor. He's a part of our family. And I think that's very important to them too, to have that comfort and understanding.
Definitely. Yeah, several years ago when I did this show before, it came to me as we were doing the show. And I remembered that, I had lost a sibling, but the thing was that my parents never really talked about her. And, it was my sister's twin, and she lived for 3 days. And then she died. They were premature. And back then, there was not much they could do for them. She had been born today. She would have been fine. But they lost her. And my sister really had a very difficult time through her life, knowing that there was a twin and there wasn't much acknowledgement at all. And I think there was so much pain and just so much, also not knowing that she was a twin actually made them just kind of say, well, we thought we were having, and I think that's the way my parents dealt with the grief. But for my sister, it was very difficult. So there's also the siblings too,
Right.
that are involved here. And, if they already know about the children, if they already know about the child, if they're old, if they were born before, it's something to keep in mind, is that you've got other children or siblings going through something. The whole family's grieving.
Well, you brought up 2 interesting points. One is that generational, because
Mm-hmm.
I think that it was of that older generation who we didn't talk about things, right? They didn't
Right.
talk about anything.
Absolutely.
And they thought they were doing the right thing. But more and more we understand it's not helpful. If anything, you've got to get those emotions out. And then, the other part about the siblings, you're right. It's very important for the kids. So often they're worried, parents are worried about, seeing mommy and daddy cry. Well, mommy and daddy are human. And it's okay for mommy and daddy to cry, because they need to understand that's a healthy way
Right.
of showing emotions.
Absolutely. Absolutely. Yeah, we told our girls, and even early on, and I think that brought up another point that I wanted to make too, is a lot of people wonder, with the higher rate of miscarriage, that we're talking about, is it okay to tell people about your pregnancy too early on? Should I tell people that I'm pregnant? Should I not? And of course, it's a very individual decision whether to share about your pregnancy. And I always tell people, if you tell the people that you would want to tell and need support from and want to share if you were to have a loss. And when it's put that way, most people say, oh, okay, that makes sense to me. And even with our children, that's how I felt. We told them very early on, and so they knew, and then they also knew about the loss, and then we all as a family were able to go through that together. And I can't imagine ever having hidden that from them.
Right.
No. So, and they
People,
were,
well, and people don't realize kids sense stress. You can try to keep it from them, but they know something's wrong. And chances are,
right.
if you're honest with them, it's a lot easier than what they don't know.
Absolutely. No, they'll feel it. They will feel it. Absolutely. Um, you had mentioned something to me about self-care, and I think it's such an important um, part of this is to, we started to talk a little bit about giving yourself space, but, what does that look like? And making sure that you're taking care of yourself and the basics I assume you were talking about before.
Well, I liken it, going through the grieving process, as if you've had major surgery.
Yeah.
You need to heal and you need to take that time. And I remember, I have such a close relationship with my mom, and she was one of the people that helped me get through this. And I remember those first few days, I would congratulate myself just getting out of bed.
Yeah.
And it literally, you need to say, okay, today I'm going to take 2 steps. Today I'm going to get dressed, and go slow. Go
Yeah.
slow and don't rush. I think, the other issue is when a child dies, everybody's rushing for a memorial service or whatever. You are well within your rights to do whatever you want to do. This is your choice. And
Right.
in fact, don't rush through it, because you want to make sure that you're doing something that will feel good for you in the long run, not what felt right for your parents or somebody else, just as an obligation. And I think that's very important. The other thing is, when we talk about those well-meaning friends who may not say the right thing, for a while, you may have to put up boundaries. So I think of it as a warm cocoon around yourself. You've got to insulate yourself and only allow those positive people and those nurturing people into your life so that you can heal.
Mm-hmm.
So you got to become a little selfish.
Yeah, definitely. And the selfishness is really going to support you long term. I mean, just being able to, you don't owe anybody anything. You don't owe anybody any explanations. You don't need to explain your feelings to anyone. And I think, you've got to deal with yourself and not worry about other people.
Right. I think the challenge is when you have your partner. And trying to, let's be real. There's a lot of marriages that end in divorce when there's been a loss like this. And I think it's very hard because, as we said, we grieve differently. So you even have to sometimes isolate yourself from your spouse for self-preservation, but also to preserve that relationship. Stay apart for a while to grieve in your own way and then come together. And that's okay. Give yourself that time.
Yeah, absolutely. I was going to say, there's so many people here in the chat room and so many moms that I've heard from that have had multiple losses. It's, recurring miscarriages, losses and infertility issues, and just how difficult and how hard that can make any future pregnancies too. And I'm just wondering, the fear of it happening again. With my experience, it was my last. I had already had 2 children, and it was my last pregnancy, and then we didn't have any more children after that. But I know so many people get so nervous for future pregnancies that they actually miss the experience of the joy of it all. And so I wanted to ask you about your experience of having children after Connor and what that was like for you. Did you experience any of that?
I did. And, I think it's hard to even describe, because everybody said that to me. I think I was better than most people. And as much as there are some statistics that say there's a higher likelihood of SIDS a second time or more, I felt like lightning can't strike twice. I really felt that in my heart, that this baby's going to be okay. Now, having said that, it did make me more protective over other issues, and I think I became more aware and cognizant of that. And I can tell you, I don't think my poor son Spencer slept through the night the first year, because I was constantly pinching his toes and checking. So from one perspective, it made me more aware, but I felt like it was the right thing for me. And I have to tell you, I'm a very spiritual person, and I have strong faith and strong belief. And that is what carried me through.
Yeah, absolutely. And it's important to just realize that each time is different too, so that you can enjoy what's going on in front of you as well. But the pregnancy will possibly bring up, and most likely will bring up, emotions and sadness from the past, and to expect that and not to think of it as a premonition. I think that was one of the things that I would always, be aware of just as Alison said before, the grief never really fully leaves you. The thoughts never fully leave you. And so when people become pregnant again and they have these thoughts, it's all of it just resurfacing, and it makes such perfect sense that it would right at that time. So
yeah, and I think that as you go through those milestones, right? So whether it's a miscarriage or a stillbirth, when you pass that last time, you breathe a little bit more of a sigh of relief.
Yeah.
But there's going to be those times, and especially, you're so hormonal as it is,
Yeah.
and to put grief on top of that, it's just, and that gets back to that self-preservation and really self-care, because being pregnant, you've got to take care of yourself. And then when you think about, depression, you really have to be mindful of how you're caring for yourself.
Definitely. One of the things that my sister went through, and this happens, of course, with anyone who's had any kind of a loss after 20 weeks, and of course, during that first year, is she didn't even think about the fact that she was going to have to deal with her milk coming in. And that was a very big deal for her. She had breastfed her first two children, and she just didn't think about it. And I thought about it during the birth and decided, we'll talk about it right after. And for a while, she thought, well, maybe when the milk comes in, I would donate the milk. And some moms do choose to do that they, decide it's what they can do it actually is therapeutic for them, and they know that they can contribute to another baby. But she tried it, and then within the first day or so, it was just too painful for her to continue pumping. And it's a whole other aspect that a lot of moms don't even think about, that, they have to deal with, as well as depression, hormones, all the other things of going through a birth.
Yeah. And I had the same thing. I mean, I had been nursing Connor. So, literally one day I'm nursing, the next I'm not. And that was, you're right, it was incredibly painful. And those are the things that no one is going to understand. They're just not. And that's why I think it's so important. That's why, I do encourage people, if they are looking for online support groups, go to CJ First Candle. We have one for stillbirth, one for miscarriage, one for SIDS and SUID, because these are issues that not many people understand and can relate to. Absolutely.
Joe's going to put up the links for First Candle there so that it's easy to find. Joe has them, and he'll be Joe's far away from me tonight. Hey Joe, put up the links. My computer's not working, so he's in the other. He's usually sitting very close to me. He's not tonight, but he's going to put the links up for everybody. Another consideration that I had never thought about until I did my last show, but we had a guest the last time. Her name is Carrie Bundy, and she had lost her son Mason to SIDS at around, I think the baby was maybe 3 months old. I don't remember. I think 3 months. And after she lost Mason, she created a organization called Mason's Cause that was dedicated to covering costs of funeral costs for people who did not have the money to cover that. And it was just so heartbreaking, because I had never thought about the fact that, you lose a baby, and now, to have a service, to have a funeral, to buy a casket, you need money to do that. A lot of young parents just don't have the money. So it's just another thing that to consider and think of. And when you're offering support, if there's anything that you can do to support someone, that might be even what they're choosing.
Well, you just said a very interesting word, support. What can I do to support? And I know we're going to talk about this, but especially when it comes to friends, there's usually that, what can I do to help you? And in those first few days, you're so out of it, you can't even think about what you're going to do. And again, my loss was 20 years ago, but there are great social media places like Lots of Helping Hands, where a friend can go on and set up a whole thing where people can deliver food or can do something else. And, I think it's important for people to keep in mind, don't ask what I can do to help, because no one knows
about it. Yeah.
You can't think about it. But you know what? If you're a good friend, grab her and literally drive her to get a manicure, or take a walk, or if she has other kids, offer to babysit and take the kids out. It's those things that, I'll be honest, there's probably blocks in my memory when Connor died that I don't remember. And I think that's, a protection mechanism for us just to stay sane. But there were so many kind people at that time that were helping, and I don't even remember. They kept me going.
Yeah, absolutely. And you brought up such a good point, is just take them, don't ask, what can you do? Including like, can I make you something to eat? Just bring it.
Right.
And don't just, and think of all the meals, think of breakfasts and lunch and deli platters and fruit salads and things that, because you really, I'm assuming in those first weeks, you can't do much for yourself. You're going to need all the help you can get. Or if there are other children, offer to, play with the children, be with the children, bring things to do. Think of the ways that you can support that they can't ask you for.
Right. That's so important.
Mm-hmm. Definitely. So similar to some of the things we talked about, even with, just having a baby and postpartum depression. We had a show recently about that. And, when anyone's going through anything difficult, it's very hard for them to ask or to say, this is what I need. And a good friend just kind of does it. And when you offer, let's get together, have a real date. Don't say, let's get together sometime, or, like really just call, reach out. It's such a difficult subject. It's like almost a taboo subject, even talking about it here. People just are afraid. They don't know if they're going to say the right thing, so they stay away. And it's probably the worst thing that you could do is to not say anything, or to stay away and not acknowledge.
I think the most ironic, funny thing is, and I don't know about how it was for you, but I found myself consoling people.
Oh, yeah.
I remember at Connor's memorial service, there were a few colleagues at my office who were pregnant, and literally the fear in their eyes looking at me, they just, because I was a reality they never thought would ever happen. And to see me, they saw that it could happen. So I found myself consoling them and comforting them. And I'm like, oh my gosh, but it was okay. It was my way of helping and healing.
Yeah. And the thing, it's just, you're not going to make it worse. It already is worse. You're not going to make it worse by talking about it, and and asking, how are you feeling about it? Like bringing it up. If someone starts to cry, or if someone feels sad when you do bring it up, it's not because you brought it up. You've actually given them space to express themselves. And I think a lot of people feel like they need to cheer someone up, which is not helpful at all.
Right. I'm sure that everybody in this chat right now has some sentence and some story that somebody did that was just so incredibly, just not thinking. It was amazing. But, and I'd love for everybody to just kind of chime in on any they have.
They are.
But,
they are.
Well, the one that was just the hardest for me, and it is my ex-husband now, but a month after Connor died, he came from a big family, and they would have family reunions, and he was one of 7 siblings, and they all decided to take family portraits, each individual family. And I had just lost my son, and it was just unbelievable that they even considered doing this. But then they also went on, and his own mother wouldn't call on the anniversary because she didn't want to remind us. It's boy. Do you think I'm not thinking about this? It's not that you can't. So people don't know. People just don't know how to grieve. You don't have a manual on how to have a baby, and you don't have a manual on how to grieve. And it's just so personal that you have to go with how you're feeling.
It's so true. And that's why talking about it like this, I think, is such a huge thing for us to discuss it. It's like bringing it out into the light so that we can become more, it's not comfortable, we can become more familiar with what we can do to be there, or if we were to experience it ourselves, what that would look like for us, and to give ourselves that permission. It's sort of like the permission to feel sad.
Right.
Yeah. And I think that we could talk a little bit about what's like some good things to say, what things not to say. You started to hit on that a little bit, but I'd love to go over some ideas, because people really do want to know, like, what what would be the right thing? How can I support my friend? She just lost her baby. She just had a miscarriage. What is the right thing to do? What are some tips that you?
We had I was dealing with a young woman who called me because she was one of 4 friends and they all had babies at the same time. And one friend lost their baby to SIDS. And the
Yeah.
3 friends didn't know what to do because they all had babies. And she was struggling with this.
Yeah.
So the first thing I said was they needed to have an honest conversation with her. And by honest, to say, if you can't be around us sometimes because it's too painful, we understand and we're not going to take it personally. Having those honest conversations and opening up and inviting the person to explain how they feel is huge.
Yeah.
Never assume.
Yes. No, it's such a good point. Such a good point. And not avoiding, it's like thinking that if you're avoiding the conversation, you can actually be avoiding the person, which is the opposite of what you want to do. You want to let them guide the conversation, but give them the opening to say, how do you feel about this? What would you like from us?
Exactly.
Mm-hmm, mm-hmm.
And like you said before, it's less about talking and more about listening. And not even saying, tell me how you feel, because you can't describe it. But the best things I had was when somebody would come up to me and say, what's your favorite memory about Connor? Or what's the funniest thing about Connor? We love talking about our children.
Yes.
Invite that in, because that's a wonderful thing.
Mm-hmm. Yeah. So it's so opposite of what I think others would think that you would want to say to someone, is to like remind, again, like you said, like as if you're not remembering already, but people could think that they're reminding you of something too painful, whereas it's actually bringing back the joy and the love that you have for that child that will never go away. And remembering them on the anniversary date, sending a card and saying, I'm thinking about you and I'm thinking about your baby. And, those are things that I think especially as time starts to go by, in the beginning, I assume there's a lot of people, as with any loss, there's always a lot of people right in the beginning, the first week, around the funeral, or when something first happens.
Right.
There's always a lot of people around, but what about a month later? What about like 6 months later? What about a year later on the anniversary? It has not gone away for that person, and to know that someone else is also thinking about it, I think would be very comforting.
And that's such a good point you make, because that's what people always think. Everybody, those first few weeks are racing over with stuff. And I remember my best friend flew in from Los Angeles when Connor died, and I didn't even ask, she just showed up. But then after the memorial service, everybody went back to their real lives and their normal lives. And there was nothing left that was normal for me. And like you said, 4 weeks later, 5 weeks later, it would have been awesome to have someone say, hey, I made you dinner, for no reason at all, because it could be 5 weeks later where I break down.
Yeah.
So don't assume you have to do something, those first 2 weeks or 3 weeks. It's even better if you don't. Wait for a while, because that's when they're gonna need you.
Definitely. Those moments are going to come later, and no one's going to be around to do anything about it. So that's a good time to be present and to make sure that you keep calling and being there.
Yeah. And I think some things that I would want people to remember. Somebody told me, and again, when I first lost Connor, I got in touch, and keep in mind, 20 years ago, so there wasn't social media, but I did get in touch with First Candle. And it was at the time First Candle, now it's CJ First Candle. But somebody had told me the advice, get a lock of his hair. And I did. And I still have that hair. And it's little things like that if you rush through arrangements, you may not think about. So I would encourage even people who don't have a baby, but have friends who are having babies, think about things. And I hate to be morbid about it, but you don't know what's coming up. You don't know the good advice you can give a friend when they're going through this that they never would consider.
Yeah. Or knowing the resources of where to go, so that I'm sure you have all kinds of recommendations and things like you're describing on the site of being able to guide someone to the right place or going there yourself so that you can just offer those suggestions.
Yeah. And the other thing I would, there's also the siblings, there's the parents, but let's not forget about the grandparents. I know how hard this was for my mother, and it's still hard for her to this day because she's watching her baby suffer. So I think it's also very important to reach out to those grandparents because they almost feel marginalized. They don't feel like they should be getting the attention, but they're in just as much pain.
Oh my gosh, it's such a good point. Yeah, I think about, how my parents would have, felt with something like that, and they're so close to the kids, and that they must feel like they need to be the support when they really do need support.
Exactly. Exactly. I mean, I think that's the only time I'd ever seen my dad cry. And I think it was as much for the loss as for just his inability to fix it for me.
Totally. Totally. Oh yeah, it's a good point. And all the family, everybody's so happy when a baby comes in that it's just not what you expect. It's the last thing that you expect.
Yeah. And I think that, it's interesting because I'm glad you're talking from the miscarriage side because it's not just about SIDS or stillbirth. It's about those miscarriages and a loss. I always say this, a loss is a loss is a loss.
Yes.
And every one of them deserves to be honored.
Definitely. Definitely. And I think that sometimes with a miscarriage, it can be dismissed. It could be, and I've actually had that happen to me, from friends, from family, where it's like, well, it was only 12 weeks and, saying things like, well, it was probably better off, or, there was probably a reason. Those things don't really matter.
Nope.
You don't want to hear that. And it's your child, no matter how you look at it, no matter how early it is, it's still a baby. It was still your child. And, I think that can sometimes be harder for someone who has an early miscarriage, who is not understood. Right. And there is no space for their grief, and there is no space for their sadness, really, because other people start to, I guess, judge what they think they would feel like, or what they think is what is appropriate for the circumstance.
And then there's also the guilt thrown in when maybe it's not a planned pregnancy, but then you're happy. So you've got so many different emotions internally, and then you've got all of these other outside pressures coming at you. It's enormous, and that goes back to that self-preservation.
Yeah, absolutely. Absolutely. What are some of the other things that people can do besides what to look like, what to say? What are some other things that people can do for you or that you can ask for? Or, I'm just trying to think of like ways that we can offer support right now to the audience of if they have a friend, or with the statistics being the way they are, if you don't know someone, you will know someone.
And chances are you do know somebody. So my daughters do all-star cheer. And when I first took over at CJ First Candle, I was going into the gym and somebody asked what CJ First Candle was about. And I told them, and she literally came running out to me in the parking lot, tears streaming down her face. She had had a stillbirth 7 years prior, and she hadn't told anyone. And just the ability to be able to talk. So I guarantee everybody knows somebody. They just don't know about it. And when you give the permission to talk, it's amazing.
Yep. I find that with the miscarriage. As soon as I talk about it, they say, oh, me too, or oh, my sister, or oh, my, as soon as you talk, then people want to talk as well. And so I guess like sharing, I wonder if you've had people feel uncomfortable at times with you, or you felt like you wanted to talk about it and other people are uncomfortable.
All the time, all the time. Well, it's funny because along with what I do with CJ First Candle, I'm a national safety expert known as the Safety Mom. And I do a lot of TV segments. And very often they'll say, how did you become the safety mom? And I'll start going into my story about Connor, and they'll say, oh, I'm so sorry if you don't want to talk about it. And I always tell them, no, I love talking about it because, one, it's healing for me, but if it can help one other person who's suffering, it's so worth it. But yeah, there's so many people that are uncomfortable. Death is uncomfortable. Death is uncomfortable for people. And, I kind of jokingly say this, we're all going to die. It's a part of living.
Yeah.
And it's a horrible part and it's a painful part, but it's a part that we need to talk about.
Yeah, absolutely. Absolutely. I think that the more that you talk about it, people start to understand like, oh, okay, this is okay. And then it will make it more okay for others to start talking about their pain, their grief. I wonder where, there's got to be a point though where you can also be looking out for depression in somebody. Where's the line between normal, healthy grief and sadness and depression and mental illness that could result from all of this, and it probably doesn't happen as often as we think. But
let's throw in the potential of postpartum depression.
Exactly.
So you've got so many different things going on. It's very hard to tell. And there's a lot of links between, and we're going to be doing some webinars at CJ First Candle, one especially about depression and postpartum depression, because that in and of itself could become a SIDS risk if you're taking the baby to bed with you or drinking or something like that. So I think it's so important not only for the mom to be aware of the signs of depression, but more so for the family, for the spouse, and to understand that it's okay to get help. Because so many times, so many women go untreated for depression. They think it's something they can get over, and it's not. It's a serious issue in this country.
Yeah, absolutely. And when you mix the two together where, it's the one unique time where we're combining grief and loss with postpartum. And those two going hand to hand can really create serious depression in somebody.
Yep, exactly.
Yeah.
I saw somebody was just posting about their rainbow baby. And for those of you who don't know what a rainbow baby is, it's the baby after it's the subsequent baby after you lost one. And, that's also it's a wonderful time. It's a bittersweet time. And, having Spencer after Connor, I didn't know if I was happy having another boy, if that would be too real, or if I wanted another girl. And again, that's one of those things. It is what it is. Right. You can't control it, and you need to find a way to go through it. And it was an incredibly joyful time, but it was also a very stressful, nerve-wracking time.
Yeah, absolutely. Absolutely. Oh, well, I'm just so happy to see so many people joining us here in the chat. And some of them I know that have experienced this themselves and that are here to share their experiences, to talk about it. It's a conversation that we need to keep on going with, and go over to CJ First Candle, support the organization too. It was so nice to be with all of you in the fall at the gala to really, thank you for inviting me there, and for such a wonderful cause and such a wonderful support network for parents. We need this so much, and you guys do such amazing work, and I'm just grateful for it.
Oh, thank you. And I want to let everybody know. So not only do we have online support groups, we have peer supports, and we also have bereavement materials that we will send out to anyone. But we do need your support, and we need everybody's support. Even $5 goes so far in being able to get that bereavement materials into hospitals and funeral homes and continue supporting everybody. So every bit goes a long way.
It's huge. It's huge. It's the one thing that we don't want to always look straight in the face of, but just think about all the people, like we talked about, that are going through this, and there's so many of them. so many that are getting support through it. How long has CJ First Candle been around?
So First Candle and CJ Foundation for SIDS merged at the beginning of this year, but each organization has been around for over 20 years. And, you know, we're this small organization, and not only do we do bereavement support, but we're out there educating people about the importance of safe sleep, because first it was back to sleep, and that reduced the rate by 50%. And now with the new safe sleep guidelines, which is nothing in that crib, no bumpers, no stuffed animals, no blankets, just a firm mattress, we can reduce the risk further. So that's a big thing for me, and research as well, because we want to end this.
Yeah, absolutely. Absolutely. It's wonderful work you guys are doing. Oh, Alison, I'm so happy that we got to do this show. It's been a while, and I can see from everybody in the chat that everybody's really grateful for the conversation. And I'm asking everyone to please share this, tag your friends, share this post. I know there's a bunch of people who actually just, it was too painful for them to actually make it with us live tonight. Too difficult to be here, and yet
look at all those hearts.
I
Thank
know
you.
they're sending a lot of love, and I'm sending you a lot of love too for speaking about it and for the work that you do. And I'm just really happy that we're going to be able to keep working together moving forward, and I can support you. And I love it.
We could do some great things together.
We are going to do some great things together. And as you were talking, I was saying we're going to do a safe sleep conversation coming up soon. I think we definitely need to be doing that. And the SIDS prevention, and just so much good information. Yeah, but I love all the hearts. Yes, we love all of you, and thank you everybody for being a part of this tonight. Thank you to Love to Dream and to Lalaboo, and thank you for supporting this. Thanks for being with us.
Thank you to all of you, and have a great evening.
Oh yeah, you too. Have a good night, everyone.
Take care.
Bye.